Hi, I'm Leigh-Anne Stafford, Director of Oakland County Health and Human Services. I'm here today with a COVID-19 update. The state's COVID-19 vaccine dashboard reports that just over 752,000 Oakland County residents 12 years and over have been vaccinated with at least their first dose. We are currently at 70.6 vaccination coverage for residents 16 and older who have received at least their first dose. Thank you for everyone that has helped meet this goal. However, our work is not over. Today, I have our medical director, Dr. Russell Faust, to talk about the Delta variant. Hello, Dr. Faust, and good morning. What can you tell us about the Delta variant and why it is so concerning?
Well, Delta variant is a naturally occurring mutation of the SARS-CoV-2 virus, which is responsible for COVID-19 infections. What we know about this Delta variant is that it is much more contagious, infectious than the original virus strain. The Delta variant accounts for a growing proportion of infections in the United States, and people infected with Delta variant are more likely to need hospitalization than those infected with earlier strains. It is more infectious, and just to allow people to relate to that level of infectivity or contagiousness a little bit better, it's about the same as chickenpox. It's much more infectious than Ebola, smallpox, the flu, the common cold, and other viruses that we're familiar with.
So, a lot of times we get questions about the effectiveness of the existing COVID vaccines that are out there. So can you tell us a little bit how these vaccines and the effectiveness against this variant?
You bet. So we're fortunate in that the three main vaccines that are available across the United States are still effective against the Delta variant, and in fact, all the variants that we're aware of right now. Just to put that in perspective, fewer than 1% of people who are fully vaccinated will get infected with this Delta variant, and those are called breakthrough infections. Those breakthrough infections are extremely rare, far less than 1%, but most importantly, those people are protected against severe complications needing hospitalization or in fact fatality. That is, if you're fully vaccinated, you have less than 0.004% probability of needing hospitalization and less than 0.001% risk of fatality. So you're protected if you're fully vaccinated. These are great vaccines. If you are not vaccinated, those who are unvaccinated have a 25 times higher risk of needing hospitalization and a 25 times higher risk of dying from their COVID infection.
Wow. Well, what about people like us that are vaccinated? Can we spread this Delta variant?
Yeah, absolutely. I mean, the problem is there's no vaccine that's 100% effective. And so, yes, we can get breakthrough infections. And again, less than 1% of us who are fully vaccinated will have that risk. But if we do become infected with COVID-19, there's a small chance that we can spread that infection.
So recently, CDC came back out with a recommendation that in areas of substantial or high transmission in the community, that communities should think about wearing, or community members should start thinking about wearing masks again indoors. Can you maybe elaborate on that and kind of go through why that's important?
Yeah, absolutely. I mean, back to the point I just made is that even if you're fully vaccinated, you're still at risk. In those communities where there's a substantial or high level of transmission, that increases the risk of even fully vaccinated people becoming infected. And in that context, CDC is advised that if we're indoors, regardless of your vaccine status, we really should be masking. So, I mean, to help push down the risk of infection, to help push down the transmission level, we all need to be wearing a mask indoors in those communities that have substantial or high level of transmission.
Great.
And I actually have a little cheat sheet here. The substantial level of transmission, which is where we are right now, is based on the cases per 100,000 in the past 7 days. And I think we're something around 55 cases per 100,000 in the last 7 days. And that's what put us in that substantial or orange category.
So is there anything, additional messages you'd like to share with us, or maybe something you'd like to follow up regarding vaccinations or the Delta variant?
Yeah, there's really 2 points I want to make. The first is that every active infection is a factory for these mutations, these variants. The only way we can prevent that is to get vaccinated. So please get vaccinated. Please talk to your friends and family about becoming vaccinated. This is really the only way that we're going to put an end to this pandemic.
Great. Thank you so much, Dr. Faust. That's some amazing information. And just to remind everyone, the Oakland County Health Division is still hosting vaccination sites throughout the county. And we have a daily clinic here in both of our offices, in our North Oakland Health Center, which is in Pontiac, and our South Oakland Health Center in South Office. And those times and those clinics run 9 a.m. to 4:30 p.m. You do not need an appointment. You can just walk right in. We do continue to focus on specific demographic groups in local communities where vaccination rates are lower. So please visit our website if you have not been vaccinated or you need a family member, you need help to get their vaccination. Check out our website at oaklandcountyvaccine.com to find a vaccine location near you. And finally, we want to remind any resident who received their first dose of COVID-19 vaccine between June 24th and July 23rd is to go to our website at www.oaklandcountyvaccine.com to complete the form and get your $50 gift card. If you need assistance with that, please call our nurse on call line at 1-800-848-5533 for assistance. Thank you for listening and have a great week.